Flames in a fireplace or on candlesticks can make an evening special, but it takes only an instant for fire to become a deadly menace. It's of the greatest danger to those who can't see or hear its warning signs, or who can't move quickly enough to escape it when it burns out of control. That's why we want to make sure that as many seniors as possible learn how to protect themselves against it. Let's see what Montgomery County, Maryland is doing to help its seniors learn the fire safety basics.
Fire presents a threat to people of all ages, but it's especially dangerous for the elderly. In the United States, the chances of dying in a fire are greater for seniors than for any other age group. They're 3 times the national average for people ages 75 to 85, and 4 times the national average for those over 85. And every year, an estimated 1,900 adults over the age of 65 are injured in a home fire. Tom Carr, Fire Chief for Montgomery County, Maryland Fire and Rescue, sees clear explanations for such disturbing statistics.
Seniors are at risk in a fire more than the general population for a number of reasons, but most specifically concerns about mobility and diminished senses. Seniors often are taking medications which may cause drowsiness or less awareness of what's going on.
Even if the causes are now understood, the problem that fire poses for seniors seems to be getting worse. The National Fire Protection Association, or NFPA, reports that from 1980 to 2002, the percentage of deaths of adults 65 and over in residential fires has increased from 19% to 26%. Chief Carr has seen the trend in his own community.
One fire fatality is too many. We've had 1 fatality this year and 5 fatalities last year, all of which have been senior citizens.
Residential fires can be caused by everything from improper use of home appliances to carelessness with candles. But Chief Carr has no trouble identifying the greatest sources of danger.
Certainly cooking is the #1 cause of fires, and very concerning, and certainly has great impact on property damage as well as injuries and death. The greatest cause of fire leading to death is smoking.
To combat the danger that fire poses for seniors, Chief Carr, along with Montgomery County, Maryland Executive Doug Duncan, helped put together a senior fire safety task force in March of 2006. The task force, in turn, has implemented a number of fire safety programs, including the National Fire Protection Association's Remembering When program.
Obviously, we're alarmed by the number of deaths we've had in the last year or so of senior citizens, and we are pursuing this aggressively with our senior task force. The NFPA Remembering When program is a 16-initiative program, 8 specific to fire prevention and 8 specific prevention. And certainly this is a program that we are advocating across the country, and a program that will help lead to safer seniors.
Among the preventive measures promoted in the program is the installation of smoke detectors throughout your home. The minimum suggested number of detectors is 1 for each floor. But as further protection, Chief Carr also recommends placing smoke detectors in your kitchen and in any rooms in which smoking takes place.
Not only having a smoke detector, but having a smoke detector with fresh batteries in it. Batteries that are changed twice a year to assure that they get as early as possible notification of a concern. In addition to having a smoke detector, which every home must have on every level of the home, the next level of protection is to have a sprinkler system in your residence. And the combination of a smoke detector and a sprinkler system really maximizes the potential for a positive outcome in case of fire.
Fire safety advocates are tackling the danger created by cigarettes from another angle as well. They're pushing for laws requiring that cigarettes be made fire safe, manufactured to look and taste like traditional cigarettes, but with a special paper that stops burning if the cigarette isn't being smoked. According to Chief Carr, supporters of the measure in Maryland are encouraged by the results achieved in other states.
New York and California have already passed such legislation and seen a significant reduction in the number of deaths relating to smoking.
In spite of all preventive measures, however, a fire still can happen anytime, anywhere. To give yourself and your loved ones the best chance of survival, Chief Carr urges you to avoid making common mistakes, such as not heeding the warning of a smoke detector or attempting to put a fire out yourself. In addition, he advises that you plan an escape route so you know exactly where to go in a fire emergency.
Have a plan, an escape plan, a plan that's practiced prior to a fire occurring, something that's practiced and established and agreed upon before an emergency occurs, and a plan that allows you to escape from every area of the structure, so that it's not a plan based on you being in the living room and in fact you're in the bedroom, but a plan that involves your entire occupancy.
If you need advice, Chief Carr says contact your local fire department. That's what they're there for.
Local fire departments are happy to help establish plans and consider the specific occupancies and any concerns the occupants may have. So certainly any local fire department will help make a plan or review the plan that you've established to make sure that it's a plan that's valid and a plan that gives you the best protection.
We're fortunate to have with us today Sharon Gamache, the Executive Director of the National Fire Protection Association Center for High Risk Outreach. Ms. Gamache creates and runs fire and life safety programs for people who are most vulnerable to fire deaths or injuries. She's worked with local leaders on fire safety strategies in the southeastern United States and in the Navajo Nation. Ms. Gamache, thank you for being here.
Thank you. I'm very pleased to be here, Alex.
One of my questions is, what are the principal mistakes that seniors make that can cause fires?
Well, I think if we look at the major causes of fire death, it's smoking, it's heating, and it's cooking. These are the major causes of fire death for older adults and people of all ages. So some of the things that they can do to prevent fires, things that they might do, for example, is having dropping ashes between cushions in couches, or leaving a cigarette, or smoking in bed. These are some of the kinds of things that can cause a fire. Another thing would be when you're cooking is having loose-fitting clothing that might get into the fire, or leaving cooking unattended and going into another room when you're sauteing or frying something when you should really be watching the stove.
These are applicable for almost anyone, not just
really,
a senior.
It's true. It's for everyone.
Now, when we do talk about seniors, and especially those over 60, there are some things that may be more problematic in terms of escaping a fire. Tell me a little bit about that.
Okay, for everybody, the most important thing is having an early warning to get out fast. So that's true of all people, but particularly for older adults that may have some kind of limit in mobility limitations, or it may take them a little longer to get out. Maybe they haven't planned before, they haven't thought about an escape plan, and it's very important that they have a plan so that they have time to get out in a fire.
There's such a wonderful program that you were an integral part of called Remembering When.
Yes.
Tell me a little bit more about that.
Okay, the Remembering When program of fire and fall prevention for older adults we developed with the Centers for Disease Control and the National Fire Protection Association, and it teaches about fall and fire safety. And we really looked at the statistics of who was dying in fires, and older adults are 65 and over twice at risk, 75 and over 3 times at risk, and 85 and over you're 4 times at risk. And we thought we really need to do something to educate people all over the United States on how to prevent these fires. So we developed an interactive program. We did testing with older adults in their own communities to see what time of day would they like to meet. How would they want to interact with this program? We developed a program that would focus on group presentations, home visits, people that are already going into the home health care workers, visiting nurses, to teach these behaviors, and also smoke alarm installation programs where fire departments all over the country installing smoke alarms in the homes of older adults.
So how widely is it disseminated then?
It's in about 30,000 communities right now. We gave a great number of the programs away free at the beginning, about 5,000 to fire departments that requested it. We also have 5 states that the Center for Disease Control funded comprehensive programs, so they really got these programs all over the state in every community.
That's great. Very quickly before we take a break, smoke detectors, where should they be placed in a senior's home?
Okay, smoke detectors, smoke alarms should be on every level of the home, outside each sleeping area, and if possible, also in every bedroom. and they should be tested once a month.
Okay.
The batteries should be changed at least once a year, unless you get a smoke alarm that we're advocating that you get an alarm that has a 10-year lithium battery, so that will last, the battery will last the life of the alarm.
That's great information. We'll show some products right afterward.
Okay.
When we return, Sharon Gamache will show us simple techniques and devices that ensure fire safety in everyone's home. So stay with us.
Do you know? Where is the best place to put a smoke detector? Do you know the answer? Smoke detectors should be placed on every level of your home, including the basement and especially near sleeping areas. They should be installed high on the wall or ceiling, at least 4 to 12 inches away from the nearest wall.
Welcome back. We're joined again by Sharon Gamache from the National Fire Protection Association. So you're going to show us a few things that are some great products for mature adults, especially when they're in the kitchen and places like that. But what I want to ask you first is, how can a senior actually prevent or avoid a cooking fire?
Well, I think the first thing is to not be too close to the fire, not having things dangle into the stove itself. Many older adults are too close to the fire with dangling kinds of clothes. So wearing either sleeveless or short sleeve clothing when you're cooking, not having kinds of gowns and robes that might dangle into the fire would be one of the most important things. The other thing is not leaving anything that can burn near the stove. Bread wrappers, cabinets being too close to the actual burner, dish towels, that type of thing on the stove.
Right before you show us some of the products and one of the ways to prevent grease fires, for instance, tell me, if a fire occurs in the kitchen, what should a senior do?
Well, if a fire were to occur, let's say, and it got on one's clothing, then they would need to stop where they are and drop and roll on the ground to put that fire out. The most important thing that they have to remember is not to run, let's say, to the shower or run outdoors if their clothing catches on fire, because that will only fan the flames. And that happens among a lot of older adults because they don't realize that they're just going to add more oxygen to the fire. So that's one of the things.
Because of frailty of the bones, again, before we show this, these products, what should a senior in particular do when it's stop, drop, and roll, correct?
Right. Mm-hmm.
Because of their frailty, do they need to grab onto something? Is there anything that's...
No, they just get gently on the ground and roll until the fire is out. Now, we don't suggest practicing this like we do with children because of the frailty of bones. But if your clothing is on fire, that is still the best way to put it out. And you take a risk of breaking a bone just because the fire is so much more threatening.
Okay. Now, show us a little bit about what you do in the kitchen with a pan like this.
Okay. One of the things we like to have older adults do is to use pots and pans that are not too heavy, that are easy to manage and lift. And in this case, like this frying pan, any kind of pan that you would use, you'd keep the handle away from the edge, so you can't push it off by walking by it, or if you have grandchildren around.
I was going to say, great for grandchildren to keep it out of the way.
That's right. And then if you were to have a cooking of grease fire, for example, in a pan, we always recommend that the way that you put the fire out is you just put the lid on top and then you turn off the burner. So.
Okay. We have some other products here as well. So this is a smoke alarm. But what I thought was really neat about the smoke alarm is it's got a remote, or use the remote from your television to check it.
That's
Tell
right.
me about that.
Well, there's a lot of new features that are in smoke alarms that are very helpful for all populations, and particularly older adults or people that may have trouble getting up on a ladder. In this particular smoke alarm, you can use a TV remote, any television remote, and you can test your alarm that way. And some of them use, you can use a flashlight to do that. So it makes it much easier to test it.
Well, you know, I'm actually thinking of people like my brother, and there's people who would like to have remote control for everything. Right. So again, not just for mature adults, but for everyone.
I think what is useful for older adults is useful for people of all ages.
Yeah, universally designed.
That's right, absolutely.
All right, so moving on to other product. One of the things that you've mentioned very, over and over is very important is smoking. Smoking is really a potential fire hazard. Let's talk a little bit more about that.
Okay, smoking, cigarettes are the leading cause of fire death in the home, and 40% of the fire deaths from smoking are among people over 65. So this is and they only make up like 8 to 10% of the smokers, when the average number of smokers range from 19 to 25% of the general population. So you know that they're very vulnerable to this type of fire. And the first thing that we do is we are advocating state by state throughout the United States for fire-safe cigarettes.
Okay.
And that would be that the cigarette would have a paper that has speed bumps on it.
Let me just show
Okay.
show a little demonstration of that.
Okay, so when the cigarette would burn, when it hit that speed bump area, then it would stop burning. And so we think this is going to have one of the biggest impacts on
These are the
preventing...
speed bumps here. And okay, go ahead.
Yes.
Biggest impact
on preventing fire deaths in this country today, because it is the leading cause of fire deaths in the country is smoking. So we would like to see, there are 6 states right now that have passed where all cigarettes have to be manufactured to be fire-safe cigarettes.
But are the cigarettes themselves widely available? Can seniors buy them?
In those states that they are, that's New York, California, Vermont, New Hampshire, Massachusetts, and Illinois.
Now you can't. I don't smoke, so I'm not sure about this. But you can't actually call up and order cigarettes to be sent to you across lines or anything like that,
Well,
right?
I wouldn't know about how you would do that, but I do know in those states that by a certain date, some of them are ready, like New York. That's the only kind of cigarettes that you can get in New York right now.
That right?
But on the different dates when the legislation it's already been passed, but on the actual enacting of the law, that will be all that's available are those types of cigarettes.
Is that happening pretty quickly, the enactment of this legislation?
Well, in the
as well?
last year we've had 4 new states, so we think that's pretty good, and it represents 25 to 30% of the population in the United States. So we're hoping that cigarettes will companies will do the right thing and just manufacture all of them to be fire
Sure.
safe. Yeah.
So smoking and cooking, what are some of the other primary reasons why fires happen in residences?
Heating is one of the second leading cause of fire death in the home, and a great part of the numbers of deaths are related to space heaters. So we tell people that to be sure, any kind of space heater you may use, or a portable heater, which could be a wood burn, you could have space heaters, there's stoves like wood burning stoves, that you keep things about 3 feet away from anything that can burn. You keep the heaters and anything that can be burned, including your own clothing. You never put a space heater next to beds because that's so easy for that to burn, will start a fire and kill someone.
I know that this timer here is actually for cooking, so you don't forget to turn off the oven when you're cooking. But could it also be helpful with space heaters so that you just turn it off before you go to sleep or before?
Well, we do recommend that. I mean, you could use a timer to remind you of a number of things, but we do recommend that the heaters, the most important thing is the placement, and then to be particularly safe to turn them off when you leave the house or leave the room or when you go to bed at night.
Okay, and candles. I love to come home and burn candle, and I know a lot of mature adults like to have candles in their homes. What are some safety precautions in terms of candles?
Okay, just to keep in mind that most fire deaths are going down in this country are going down, but the numbers of deaths related to candles have been going up or staying about the same some years. So, and part of this is the greater use of candles, more marketing of candles, but we really want people to just as anything else, you always keep an eye on the candles. You keep combustibles away from the candle area. You keep anything that can burn at least a foot away from candles. And when you leave the room or you leave the home, make sure that they're blown out, the candles are out. And also, again, with grandchildren or young people that are in the house, watch them around candles.
I want to go in 2 directions now. One, I want you to tell us fairly quickly, what are the things that someone should do when a fire occurs in their house, especially if they're a mature adult? Stop, drop, and roll we talked about.
Stop, drop, and roll is if your clothing is on fire.
Okay.
But if there is a fire in the home, most of all, it will start with smoke, and that's why you need to have a smoke alarm at every level of your home, outside each sleeping area.
Okay.
And you should have a plan ahead of time of what you're going to do, because it may be different from a 1 or 2 family dwelling than it is in a high-rise building. But in most cases, in 1 and 2 family homes, you need to get out. You need to have a plan to get out. You need to have 2 ways out of every room. You need to check ahead to see, do the windows open easily? Does the door open easily? Do you have a big plant blocking your way out?
Right.
Move those things out of the way so that you can get out. Have a meeting place outside your home. Call the fire department using your cell phone or a neighbor's phone. A lot of older adults, in the smoke alarm programs that we have, I ask them when we put in the alarm, do you know what to do when it goes off? And a lot of them have not heard before that they need to get out of the home.
And now on the flip side, what should they make sure they don't do? What should they not do if the fire happens?
Well, I think one of the most important things is, again, just staying around too long. I mean, if the alarm goes off because you have toast burning, that's one thing. You recognize that right away. But staying around, trying to put the fire out when you don't have the capability of putting it out. I mean, it's really the most important thing is to get out, get everyone in your household out, and call from a neighbor's phone or use your cell phone to call.
So you should always have your cell phone by you, no matter what the situation.
Either that, or but you shouldn't worry if it isn't by you. Get out first, because you can always call for it. Most important thing is to save yourself.
Great. This has been incredible information, Sharon. Thank you so much for being here.
Well, thanks very much for having us here.